If they will choose big and unnatural, and from small but natural, they will choose small but unnatural. How much he desire to do this surgery is very important.
技术啊，那些都是最基本的，其实根本不用评估，所以主要就是有没有心啊。
只看心态。
So now in Korea, the trend is already over.
大家好，我徐毅。自从阴茎增大术这个东西慢慢的在台湾越来越多被提及，很多人都一直问我，到底有没有做韩式阴茎增大？韩式阴茎增大，我是做台式阴茎增大，但是我为大家找来了韩式阴茎增大的权威 Dr.Koo。Is there a special penis enlargement that is so-called Korean style penile enlargement?
Wow, not really, because they all aim for the same goal, the bigger penis.
Since the penile augmentation was first popular in America and then to Korea, is there any difference between these two kind of enlargement?
Firstly, I would say the glans enlargement, because in America they don't do glans enlargement. Second thing is, if for American patient, they will use a very thin graft. Because they will use the graft for the burn patient, so they will use 1 to 2 millimeter. Not much big difference, frankly.
Yes.
But in Korea, as this surgery become more popular, the graft company specialized graft for penis enlargement. The difference is that they are thicker and they are less absorbable.
Now the graft that we see recently, 3 to 5 millimeters, 1 to 3 millimeters, that is specially for penile augmentation.
Yes. So you can see the slit and the hole is specialized only for penis.
Ah, that's why.
Yes.
所以也就是说，韩国人是把龟头增大这件事情继续做发展，他们有做我们植入物的改良。As we know that how we consider is the good-looking penis is different from country to country. Is there any special looking for the penis in Korea?
I will not say from Korea, but the difference is between the patient's age. For older people, they don't care about the shape. They just want a big penis like a baseball bat. If it's shaped weird, they don't care. But younger people is different. They want to have a penis shape big, but also natural. If they will choose big and unnatural, and from small but natural, they will choose small but unnatural. So it's different, it's totally different. I always tell my patient, surgery for old people and surgery for young people is a totally different surgery. Because how I use the suture and how I choose the graft is all different. I always tell my YouTuber in Korea, this surgery is patient-oriented surgery. That means we will do as the patient wanted, not like other surgery is doctor-oriented. Doctor will choose what kind of surgery is suitable for the patient.
Is there a special taste for Korean people on penis looking?
They want everything big. But if they would choose, they would like to have a bigger glans.
Bigger glans.
Just like in Taiwan, in Japan.
But for glans, do they want to look very natural, or they want to look like a dolphin?
So as I told you, for younger people, they want to look natural. Old people, they don't care if it's a dolphin or shark. They just want it big.
But for young people, if you want to do a very natural glans but big, is it easy to use Megafeel to create that kind of glans?
No, it's not easy. You need experience. It takes a very long time.
龟头要增大，目前以我的经验，还有跟 Koo 讨论出来呢，用玻尿酸要做龟头增大，其实相对是比较自然而且容易。那你要做到又大颗又自然，但是是用粉做，很吃经验，非常吃经验。你要做到变真的大颗，一定会有像海豚头或者是皇冠头的状况。阴茎体的部分其实差异就没那么大，就是要粗。There's many combination about this operation. What's the most popular operation procedure in your clinic?
We have developed a surgery. We will implant a graft and then we will inject Megafeel on top to make it even larger.
Do they also do glans enlargement or?
Yes.
How many Megafeels?
How many Megafeel they buy?
Will it influence the circulation if you?
Oh, we don't do them all in one stage. We just inject a certain amount on first surgery.
Yes.
And after 3 to 6 months, we inject again.
So why do you want to separate it?
Because they won't fit in on the first stage.
What's the maximum you can inject?
Depend on size of penis. If you have small penis, maximum maybe 3 or 4. If you have big penis like this, you can make 20 to 30. It depends on size of penis.
Did you decide it according to the megalodon size?
Yes.
For the regular 5x6 megalodon, how many cc will you inject?
It really depends, but I would say maximum will be 10.
Oh, 10 is a lot.
10 is a lot. Because if you inject more than that, it might migrate to the pubic area.
Yes. So how many percentage of megafill will survive?
You have to know how we inject the megafill. When you inject the megafill, 1 cc of megafill you mix with 2 cc of normal cell line.
Yes.
If you mix that, you come out with 2 cc to 2.5 cc.
Yes.
When you inject 2.5 cc into the shaft, the normal cell line will be absorbed, maybe within 1 or 2 days. So there will be totally 1 cc of megafill remaining. And out of 1 cc, the company told me they have 50% of absorption rate for megafill. So there will be totally of 0.5 cc remaining. From start to beginning, you inject 2.5 cc volume, actually remaining will be 0.5. Actually, not much remaining. So that's why we do it in 2 stages.
Since there are many doctors come here from abroad to learn this surgery from you, what point will you check during the operation to see whether he is a qualified doctor or not?
First, I will check if he's really actually want to do this surgery or not. Because some doctor would just come here just to see only, not to learn, but just to see. You want to just know if this kind of surgery actually exists. And when he go back to his own country, he will not do the surgery. I think how much he desire to do this surgery is very important. Like you came here for a very long time and you learn and you're actually doing the surgery. I think is how much you put effort onto the surgery, your time and effort onto the surgery, I think is important. Because most of the doctors, they are already very smart and they are very skillful with the surgery.
所以主要就是有没有心啊。
看心态。
So this is the only point you consider?
As a doctor and especially abroad, they are already quite qualified to do the surgery. Is how much they put the effort and time and how much they want to keep contact with me so that they will have feedback on surgery.
所以主要他会认为技术啊那些都是最基本的，其实根本不用评估，而且他也认为说会来的医师基本上都是专科医师，都是在各个国家有被认证过的医师了，那只是看你愿不愿意学，然后后续会花多少时间投入在这个手术上面。Recently, there are more and more doctors investing in this field. They want to do the penile augmentation surgery.
In Taiwan?
In Taiwan, recently. Yeah. Does it also a trend in Korea in recent years?
Oh, the Korea, this was a trend 10 years ago. Many people, I taught many Korean doctors as well before I trained Taiwanese doctors. But it's the same because it's how much passion they have to do this surgery. I think it's around 10%. They will keep doing this surgery. Other 90%, they just know how to do this surgery and not really perform the surgery. So now in Korea, the trend is already over.
But the patient needs this surgery.
It's always the same.
Always the same.
Always the same.
I heard that your patient number keep increasing in these 10 years. Does it mean that more and more doctors they quit this surgery?
No, doctors don't quit the surgery. It's just that more patients coming to me.
So 10 years ago, the patient population is the same, but they have many selections.
Yes, as I told you, there was many small clinics with different augmentation.
And then the old small clinic vanished.
Not many, they're still there, but they don't do the surgery because there's no patients.
I see. Since you are a very highly experienced surgeon, is there any difference between the surgery technique now compared with the original?
Yes, there's a lot actually. Because when we first urologists do this surgery, as you can see, it was not plastic surgeon, it was urologist. So they did not care much about the scar and the post-OP appearance. Main target was just to make the penis big. But now I've changed. As I meet more plastic surgeons and others, I try to make this surgery more cosmetically beautiful, like making a smaller scar, making less a bump, but many efforts so that the surgery outcome will look very natural. Before they did that, they just emphasized. They will just measure the width. Okay, you have 2 cm larger now. It's good.
This is what I'm doing now. Try to make it more cosmetically beautiful. 今天有关韩式增大的问与答就到这边到一个段落啦。喜欢我的影片的话呢，欢迎在下面留言、按赞、开启小铃铛，然后分享给你周围的朋友们。 那我们下次再见啦，拜拜，
拜拜，再见，
再见。